I would like to declare that the strike by Kenya Medical Practitioners, Pharmacists and Dentists Union has now been called off.
In a return to work formula signed last year after an agreement between the Kenya Medical Practitioners and Dentists Union and the national government through the Ministry of Health, it was agreed that grievances by doctors which had necessitated a nationwide strike would be addressed.
I can tell you to date, even after the Public Service Commission, the court order gave their orders, and even after the Ombudsman, all these procedures have been taken, these doctors have not been put to payroll. I can tell you that the doctors who are on contract under UHC, to date, they don't have the medical cover, and some of them have already been paid their salaries for over 4 months.
KMPDU Secretary General Dr. Davji Bamji says there is need to develop lobby groups among legislators, majorly aimed at improving the human resource at multiple, if not all, health facilities.
More than 90% of times, both the governors, all the state officials, they do not consume the public health care. So as much as the representative to that, they do not know how these hospitals operate or the situation they're in. So the Wananchi and everybody sees a very big hospital, but at the end of the day, that hospital cannot serve you.
Even so, most of the recurring challenges are said to be as a result of lack of implementation of the 2017 collective bargaining agreement by counties, which would have ensured not only timely promotion of doctors, but also solution-generating engagements between the employer and employee.
Almost 30 to 35 of the counties in this country have not implemented the CBA. Last week and this week, we're seeing a looming crisis at KNH, where a number of doctors, over 30, have been dismissed, and these are dismissed despite the pandemic and despite the Kenyatta being one of the biggest referral hospitals and despite the shortages of doctors that exist in the facility.
He goes ahead to lash at the devolution of healthcare to county levels while citing options to revive the sector.
You are dealing with 47 governments and then the national government. Out of these 47 governments, some of them are driven by egos, some of them are driven by emotion. So there's no objectivity in the operation that happens in different counties. And we have seen this clearly in the irregular dismissal of doctors that happened in Laikipia and Kirinyaga. And also the suffering that currently is taking place in counties of Murang'a, Kirinyaga, where doctors have not been paid up to 2 months of their salaries. So we feel that when we have Health Service Commission, that the issues of the CBA implementations will be streamlined within one body. The budgeting aspects in terms of the payment of salaries, in terms of employment of more workers will be more streamlined.
Dr. Davji welcomes on board stakeholders within and without the healthcare system to actualize proposals by healthcare workers for the betterment of services at healthcare facilities.
We are approximating that in case county governments can employ at least 30 doctors in each of the counties, that will bring about the 2,000 doctors getting employed in a period of 1 year, and that is sustainable. And the first beneficiary to this will be the Kenyans, who then will get a better service in a timely way.
Ben Kerera, K24, Evening Edition.